Alrighty, so welcome back to Drug School. I'm Adam. I'm the host that you typically hear going on behind a series of PowerPoints that I'm voicing over. Today you get to see me in live human being. Um, I wanted to start this series off of unusual pharmacy technician jobs with my own. Um, just to give you an idea of why I graduated or gravitated, I should say, to the professional pharmacy is I was in an office job, and the type of work I was doing wasn't very rewarding. And I went back to substitute teaching. I was a high school teacher before I went to this corporate job, and left the corporate world, went back to substitute teaching. And then I got to June realizing that at age 28, that your paycheck ends in June, and I ended up applying to go work for the three-letter chain. Everyone in pharmacy knows who the three-letter chain is, so I'll leave them anonymous since they haven't ponied up any money to sponsor my channel. Um, and um, so if someone at that three-letter chain corporate office wants to sponsor my channel, I'll use your three-letter name. I started there in 2008 as a technician in training and lasted there about 8 months. Um, I loved my patients and I loved the work I was doing. Um, Work environment was decent most days of the week. I worked second shift, so um, generally speaking, 3 to 11 type hours. But an opportunity came up at a compounding pharmacy, and it sounded like fascinating work, so that's how I got involved. A friend of mine introduced me to this compounding pharmacy. It was a fun job, and had a blast. And compounding, if you're not familiar with it, is a very high touch job. You do 250 scripts a day. Now, keep in mind the average retail pharmacy usually does closer to 500. So we're doing half that amount, but we have to do twice the work to get those 250 scripts in the door and out of the door. So there's a lot more people involved. And when I started at that pharmacy, we had 9 employees. We did 150 scripts on a good day. Um, when I left there about 3 months ago, we had 27 employees, and we were working practically on top of each other. The ongoing joke in our pharmacy was that it was a contact sport. Um, I never had any formal pharmacy technician training, um, but I was offered the opportunity, and I still continue to get the offered the opportunity to teach new pharmacy technicians in various roles. Uh, it, so I teach for a local community college, um, and I also teach at a private university. Their program recently got discontinued, so I'm kind of on a hiatus until my master's degree is done. As far as my formal training, my degree actually happens to be in vocational education, which is actually designed to help me teach high school. I got that from Western Michigan University in 2002. I have an associate's degree in business that I earned in 1999, and I'm really thankful right now that you cannot see the gray that is filling in this lovely forest that is on my chin. Um, I am now currently back at Western Michigan University. I'm studying for a Master of Public Health degree. Just started that this fall, fall of 2018. I'll be done fall, hopefully by the end of summer in 2020. It's a lot of work, let me tell you. Um, I just got done studying for 2 hours in epidemiology and biostatistics were my homework tonight. Those are my classes this semester. And you may think that two classes isn't full-time student work, but let me tell you, it's full-time student work because you are writing every week. Um, so on to what I do now. 3 months ago, October 2018, I left my employer. I left retail pharmacy and I went to a corporate wellness firm. And that corporate wellness firm specializes in helping companies control their healthcare costs. I run their pharmacy savings program. So we help health insurance plans design their pharmacy benefit so that they can take advantage of the coupons drug manufacturers use. And when we do our job right, the health plan usually saves about 20% off their prescription bill, and the patient gets free medication because any copay that results, their health plan reimburses them for it. They get a special, it's called a health reimbursement arrangement. So if they agree to participate in our program, their health plan makes arrangements so that they get their any of their out-of-pocket expenses back. And it's fascinating work. One of my clients last year saved $150,000 off of their drug spend. You consider the house I'm living in right now, when it was on the real estate market 2 years ago when I bought it, was $96,000. So I saved almost twice the cost of my house for a corporate employer that has about 600 people. My other client that just started in November is in its second month of my program, and it just saved about $40,000 off of its first month of drug costs. And if you multiply that out by 12, you're going to get a pretty decent number. And I do a little bit more than the program originally dictated. Um, the Some of the special things I've started doing, I help patients not use hospitals for infusion drugs. So we try to do those through specialty pharmacies now, and use the pharmacy benefit to control how much money that gets billed. And I recently had a patient who was prescribed Ocrevus, and if you don't work in specialty pharmacy, you have no idea how expensive this drug is. This drug runs $32,000 for the first month of infusion, and the manufacturer will pay a good portion of that $32,000. They'll pay up to $20,000 for that first year, and I was able to get that billed from 32,000 to 16,000. It turns out, had I allowed that to go through major medical, the charge for that Ocrevus prescription for the first two visits total was going to be $102,000. So I saved the plan a lot of money on their medical costs and on their prescription costs, and it was a great day's work. Um, Another example of what I've done, I've been able to get some of my members to take advantage of the patient assistance program, meaning they get free drugs straight from the drug manufacturer. And in those cases, the health plan doesn't actually have to pick up a dime, which saves the health plan a lot of money. And it's very rewarding work. The patient that I got on the patient assistance program, um, I just had a clinical update. His tumors are shrinking, which is fantastic news. So his prognosis is looking a lot better than it did before he was able to start this treatment. So because we were able to get him this assistance, we have been actually able to improve his overall health care, which reduces his medical costs to the plan in other places. So um, it's a very rewarding job, and I love it. It is a lot of paperwork, though. Anytime I have to go in and override a PBM, If they don't give me direct access, some of them will give me direct access to their systems. I can actually go in, put my own authorizations in. Some of the PBMs won't do that, and I will have to go get a piece of paper, fill it out um, in a Word document, email it securely to the PBM, and then send it off. It's a little bit labor intensive. It's very high touch. Every phone call I do actually end up taking, and keep in mind, um, I'm familiar with how retail pharmacy works, and you're constantly taking phone calls all day. I probably take about maybe 10, 12 phone calls a day. Um, but each of those phone calls is usually about a good 10 to 20-minute conversation. And we talk about meds and we talk about ways to keep that cost down for members. So it's fantastic work that I do. Um, you don't have to be licensed for it. I practice in Michigan. Technically speaking, I do have to have a pharmacy technician license to practice as a technician, but the job that I'm doing doesn't fall under the definition of what a technician actually does legally. So my certification is actually sufficient for my employer standards. I do hold my license, so my pharmacy technician license under state law still exists. And the reason I kept it is because some of the things that I do find as I go through and help these employers out is I am actually finding insurance fraud. It buried into these claims. And if I have my license, I'm able to report that to the Board of Pharmacy and I can get those investigations going. I can also get in contact with insurance companies a lot easier if I tell them that I'm a licensed technician. So holding on to my license was a little bit of it was optional, but it really wasn't optional. So I do hold my license in Michigan still, and I also do hold my pharmacy technician certification that I've now had for almost a decade now. So those are my job. So thanks for watching, and we'll talk soon.